Good evening.
Hello.
My name is George. What's your name?
Dawn Smithson.
Okay, what brings you in today, Don Smithson?
So I've been having some pain on my left knee while running
Okay, what sport are you in?
cross country.
Okay, great.
Junior.
Junior? Okay. Um, so you've had problems on your left knee?
Mm-hmm.
Anything on the right?
No, nothing
No.
on the right. It's only on the left.
Okay, and you said how long have you had this pain for?
It's been about 3 weeks.
Okay, and when do you feel like it bothers you?
Well, I'm fine before practice, but
Mhm.
during practice and once I'm done with practice, it's hurting.
Okay,
And it continues to hurt.
the entire knee or where?
It hurts like right below, right here.
Okay, all right, and have you ever had problems with that knee before?
No.
Okay. What have you been doing for this knee since it started hurting? Have you taken any meds or ice or anything?
I just try to put ice on it when it hurts.
Okay.
That's it.
Has that helped?
Not really.
Okay.
I mean, it helps a little bit, but then the pain comes right back.
Okay. All right. And on a scale from 1 to 10, how bad is the pain during exercise?
I would say it's about
10 being you gotta go to the hospital. So.
maybe like a 6 or 7.
Okay. And what about after exercise?
It stays about the same.
Yeah.
Mhm.
Okay. All right. And you've only been icing?
Yeah,
Okay.
I don't really know what else to do.
All right. So it only hurts right there. Okay. All right. So then, as I see the patient, I see that. Do you have like any deformity?
None that I know of.
Okay. All right. I would look at their hips for their Q angle. So can you stand up for me, please?
Yes.
All right. And then if they had a increased or decreased Q angle, the angle of their knees, genuvalgum, genuvarum, see if they had any stress, the alignment of their patella, if it's patella baja, alta, and then their tracking. So can you sit down for me, please? Again. And then extend your leg for me. There you go. Nice. All right. Can you do that with this leg for me, please? Nice. All right. Their tracking seems fine. After observations, seeing if there's any obvious deformities, any bruising, swelling. So now I'll move on to palpations and redness. I'll palpate thigh area. It's your left leg, right?
Yes.
Okay. Palpate the area. Is there any pain with this?
It's just a little tender. Not
Okay.
too much pain.
All right. And then, so I would have them initially like on a treatment table, but since we don't have one, actually, and you can like lay across a little bit. There we go. All right. Pain with that? No. Okay. Then here I'll do a lateral and medial patellar glide. See if there's any apprehension in the patient. Any pain with that?
Not really.
No? Okay. Alright. Pain with this? No? Here?
Just a little bit right there.
Yeah? Is this where your pain is mainly at?
Right
Okay.
there.
Alright. Okay, pain here in the patella?
Not really.
Alright. Do a bilateral comparison of the patellar glide just to see if one is more hypomobile or hypermobile than the other. Get a good bilateral comparison. Alright. Pain with any of this?
Mm-mm.
No? I moved your patella?
No.
Okay. Pain underneath?
No.
No? Okay. Just this side, her left side is a little more tender. Then after palpations, we would move to range of motion. So can you slide off how you originally worked for him, please? Thank you. Okay, so now I'm gonna put you through some range of motion
Okay.
to kind of get a better idea as well as what's going on. Can you extend this leg for me, please? Pain with that?
Yes. There
Okay.
is some pain.
Go ahead and relax. Do it for this one, please. Thank you. Pain?
No.
All right. Thank you. Now relax. Let me do the motion.
Okay.
All right. Any pain with that?
No.
All right. Relax. All right. This one? Pain?
No.
All right. And then now you're gonna go against my resistance in that motion. Go ahead. Pain?
Yes. A little bit. Yes.
All right. All right. Do this one. Pain?
Mm-mm.
All right. Can you lay on your stomach for me, please?
Mhm.
You know, either way. But you're,
No.
yeah.
Yes.
Thank you. All right. And then bring this heel to your butt for me, please. Any pain with that?
No.
All right. Relax. This one. Pain with that?
No.
All right. Let me do the motion. You
Okay.
relax. All right. Pain with that?
No.
Pain with that?
No.
All right. Now do it against my resistance. Go ahead. Pain with that?
No.
Do this other one. Pain with that?
No.
All right. Go ahead and stand up for me, please. And we're gonna do hip extension. So anything. Yep. Pain with that?
No.
No. Do the other leg for me, please. Pain with that?
No.
No? Okay. Hip flexion? Anything with that?
No.
No?
No.
Anything with that? No? Alright, go ahead and sit down for me, please. Alright, and so now we're gonna see how your dorsal flexion is. Yeah, point your toes for me, please. Pain with that?
No.
Alright, do this other leg for me, please. Pain with that?
No.
Alright. Now, let me do the motion. Pain with this?
No.
Pain with this?
Mm-mm.
Alright. And do it against my resistance, so leg straight. Point your toes. Pain?
No.
Same thing on this side. Pain?
No.
Alright. Bring them up. Bring your toes to your head. Pain with that?
No.
Alright. Let me do it. Relax. Pain with that?
Mm-mm.
Against my resistance. Pain with that?
No.
Alright. Same thing with this leg. Bring them up. Pain with that?
No.
Alright. Relax. Pain with that?
No.
Against my resistance. Pain with that?
No.
Okay. So then most of your pain is just with knee extension underneath the patella. Okay. And then only hurts while you're running.
And after as well.
And after. Okay. Do you know if your family or anything or anybody in your family has ever been diagnosed with like Osgood-Schlatters disease or anything like that? No? Okay.
I don't think so.
Okay. Yeah, because when I'm looking, I see some swelling under this knee. I don't know if it's just swelling from irritation or if you have a possible Osgood-Schlatters. And that's when the quads and everything are contracting, pulling on the tendon, and then this tendon is like pulling on the bone, causing it to increase bone mass at the tibial tuberosity. All right. Yeah, so it sounds to me like you have a stage 2 tibial patellar tendonitis. Yeah. best thing to do right now, to be honest, is ice after practice. Come in before practice to warm up, warm those muscles up, get a little more relaxed, so it doesn't cause that much tension on that patellar tendon. Ice after practice. We can also try to put a patellar strap to decrease that discomfort a little bit, and then come on in and we'll do some massage as well to release the tension, and hopefully get you like on a rehab program to better that situation.
Okay.
All right.
Sounds good. Thank you.
No problem.